Transvaginal sonography is sensitive to smaller amounts of fluid, so we can see a small amount of fluid in the posterior cul-de-sac. What where I with these? Raise your hand if you think that that is free fluid in the anterior cul-de-sac. Okay, and not many of you. There are 2 people that raised their hand. So the rest of you did not raise your hand. So put in the chat what you think that is. Some of you are getting to know me well where you already have it in there. Yeah, very good. That's the urinary bladder. Good. So we know where the bladder is by location, right? And it's in the upper left-hand corner of the image. Now, you could have fluid collect there as well. And so if you're scanning, you may see the bladder separate. Good, very good. I'm going to have a question. I'm going to have a harder question for you guys. Now, we can see anechoic fluid here, but if we see fluid that has echoes within it, first thing we want to do is make sure we didn't make up those echoes, right? Our TGC has to be set appropriately, our overall gain has to be set appropriately, and if those echoes are still there, then it's complex free fluid, and that is clinically important fluid because it either means that's pus and there is an infection, or that's blood and there's a hemorrhage. Again, this was added to the content outline a couple of years ago, so somebody thinks it's important that you know this for your test, okay? Complex free fluid is either blood or pus, and so therefore we're going to be sure that we show those echoes. The vasculature to the pelvis starts with the abdominal aorta, bifurcates into the right and left common iliac arteries, and those then bifurcate into the external iliac artery that feeds the lower extremity and the internal iliac artery that feeds some of the pelvic viscera, including the uterus. The internal iliac artery is going to give rise to the uterine artery, or uterine arteries, one on each side. The uterine artery is going to cross the ureter and ascend along the lateral aspect of the uterus, and it's going to give off branches on each side to feed the uterus. But then look what happens. When we get to the level of the cornual region of the uterus, there is an end-to-end connection between the ovarian artery and the uterine artery. Okay, we have this end-to-end anastomosis. That can be really helpful or really detrimental, and I don't get to choose such things. But if there's an ovarian torsion and the ovarian artery has been occluded, that uterine artery may bring enough blood supply to keep the ovary viable until surgery. So that's great. But if there is an ectopic in this interstitial or corneal region that ruptures, we now have 2 arteries feeding that area. It's going to bleed profusely, and we'll talk about that tomorrow. Okay? So uterine arteries are ascending along the uterus. We're going to flip this uterus on its side. The uterine arteries give rise to the arcuate arteries. Okay? The arcuate arteries are going to give rise to the radial arteries. The radial arteries give rise to the spiral arteries. So from outer to inner, we can see uterine, arcuate, radial, spiral. But let's talk about the arcuate arteries for a minute. Those uterine arteries are going along each side, and we have to get blood to the entire myometrium. So the arcuate arteries are circumferential within the myometrium. That word is bolded in your workbook. Please underline it as well. Okay, the arcuate arteries are circumferential within the uterus. Okay, they're around the circumference. That's how you get blood the whole way around the uterus. As we see here, okay, here are the arcuate arteries. Let me draw a circle for you. Okay, so they're circumferential. We can use that to our advantage, as we'll see a little later. So we put color Doppler on, we're going to see one uterine artery on either side. You can't really see them here. Okay, there's one over here. But those are the arcuate arteries. You're not going to have this exact diagram on your test, but if you understand this diagram, you do well in these questions. So this tells us where the vessels are coming from and where they're going. The uterine artery arises from the internal iliac artery. Okay, so it's along the surface. In the myometrium, in the outer myometrium, we have the arcuate arteries. In the inner myometrium, we have the radial arteries. And in the endometrium, we have the spiral arteries. So if you were asked with an arrow into the endometrium, what artery is this? It'd be spiral. Okay. If you're in the outer myometrium, what artery is this? It would be arcuate. I was trying to remember, or trying to think of a way several years ago for my students on campus to remember this. And so I wrote on the board, I wrote this, and from outer to inner, uterine arcuate radial spiral. And then I said, guys, you're going to remember this because you are really smart. And I thought, there's my mnemonic. I was kind of proud of myself. And one of them said, what about you are really stupid? And I said, well, whatever the S is, whatever you need to do. So, so if you're thinking about the vasculature from outer to inner, okay, uterine, arcuate, really, radial, and smartest, that is the same for the arterial as well as the venous anatomy. So if you're asked to identify a vessel, you can do so. Okay. The ovarian arteries branch from the abdominal aorta just below